wonderful part about transitioning through our programs at Great Expectations is, you can move through the entire continuum. And that includes moving into supportive housing, but still accessing treatment through our outpatient program.
Roots to Recovery is the outpatient program of Center for Great Expectations. And we have 2 levels of care here. We have IOP and we have OP.
The continuum of care is phenomenal. To have you guys still involved here, I'm just so very thankful. I've never had support like this in my entire life.
I was very passionate about working here because I graduated the outpatient program. It's had a special place in my heart, and I wanted to give back.
Here at the outpatient program, our mission is to have a safe place, safe presence, and a safe path.
Our clients, unlike some of our counterparts in the agency, come live in their daily lives. They're at home and they're working on their recovery by going about their daily activities of working and being with family and learning.
I think that's the biggest key part, is that it was the aftercare. Everything I've accomplished here, I didn't want to lose when I walked out that door.
We are so client-focused. We try to provide this continuum of care that almost catches everything, as well as also social engagement, community, and lasting relationships.
Our purpose is to provide outpatient treatment for folks in the community that need support for mental health, substance use disorder, or both.
The thing about the outpatient program here that's unique is that we're gender specific.
Per the client, we respect everybody's identity, and they can ask to join a group that would make them most comfortable according to their sexual identity.
One of the main things that distinguishes us from most other programs, if not all, that substance abuse is an adaptation to trauma. We're not afraid to go and get to the root of those problems. We're also allow the client to set the pace.
It depends on their progress with treatment goals, sobriety, and other factors too. So we don't give a time. Each client gets as long as they need to get better and to be stable enough to go out on their own.
So everybody needs somebody, right? Everybody, and we're that somebody for people who's struggling. And we're that guide to a better way. Basically, we offer resources. We guide our clients through dealing with addiction struggles, as well as refer them to outside sources if need be, if we don't provide those here, like maybe detox.
Resourcing is very important. We don't want to underestimate the importance of having food, of having shelter, of having medical support. Those things are very important.
The interesting thing about medication-assisted treatment is we are looking at it from the lens of we do not want our clients to be going on the street and using illicit substances that could potentially be dangerous. We've seen so many overdoses. And so when we're talking about medication-assisted treatment, these are things that have been studied. There's a lot of research that has gone into it, so they are more safer to use. I know sometimes people say, well, you're just substituting illicit substances with something that is prescribed. We're talking about safety here. We want our clients to do well, even if they have those cravings or if they're trying to self-medicate. We want them to do it in a safer way, a way that we are able to monitor that they're doing well, they are not going to overdose, and we are also going to be addressing the underlying problems that is causing them to actually be using or having issues of dealing with their day-to-day life, especially with mental health.
When you're able to assist the individual and teach them coping skills and realize the relapse triggers that they have and how to address them, it not only affects him, it also affects his family.
Because I have a passion for people that's addicted or suffering from addiction, because I'm absolutely sure every human being is promised death. And I know for sure you don't have to die from that. You don't have to die from an overdose or a bad batch of drugs. There's a way out, and I want them to get that. And I feel that in my heart when I'm like, I just want this person to get this. So we do whatever we can to help people.
When somebody's doing well, that's always the best news we could ever get. Sometimes some of them walk in here, listen, I got a job, I have a house, I have a family, and it's just the best news. There are no words to express.
I believe in the Center for Great Expectations mission. It's an honor and
and a privilege to be able to work here and to help others.
It's amazing work when it all comes together, when we all come together.
Addiction affects everybody. Those people out there are people too, and they need help just like anybody else. And that's what we're here to do.
How has the program impacted the people that go through it? It has saved their lives.
Have been reunified with their children, have restored themselves to their families, and have gotten gainful employment or started to go back to school, and have really kind of begun to become the people that they always were.
I knew I was going to be treated with the same care that I was treated here, and I felt safe going there. I wouldn't have had it any other way, and they've lived up to my expectations. And it's a beautiful thing to feel carried through.
Because we're going to engage like no one has ever engaged before.